Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Shaimaa Mustafa, Assistant Professor of Cardiovascular Medicine, Banha University. We will discuss today heart and systemic diseases. I will focus on connective tissue disease and the heart. What are connective tissue disease? Connective tissue are made up of two proteins, collagen and elastin. Collagen is a protein found in the tendons, ligaments, skin, cornea, cartilage, bone, and blood vessels. While elastin is a stretchy protein like a rubber band and is the major components of ligaments and skin. So, patients with connective tissue disease, collagen and elastin are inflamed, so proteins and body parts they connect are harmed. There are different types of connective tissue disease. Inherited connective tissue disorders like Marfan syndrome, in which patients are tall, thin, with long arms, legs, fingers, toes. They are typically have over flexible joints with scoliosis. The most serious complication involve the heart and the aorta, with increased risk of mitral valve collapse and aortic aneurysm. Osteogenesis imperfecta result in bones that break easily, with severity may be mild to severe. Patient may present with short height, loose joints, hearing loss, breathing problems, problems of the teeth, and complication may include cervical artery and aortic dissection. Ehlers-Danlos syndrome, there is defect in the synthesis of collagen, type 1 or type 3, causing progressive deterioration of collagens with different types of Ehlers-Danlos syndrome, affecting different sites of the body such as joint and heart valves, organs wall, and arterial walls. The second type is the autoimmune connective tissue disorders, like systemic lupus, which are common symptoms include painful and swollen joints, fever, chest pain, hair loss, mouth ulcers, swollen lymph node. Rheumatoid arthritis typically result in warm, swollen, and painful joints. Pain and stiffness often worsen following rest. Inflammation around the lung and inflammation around the heart. Scleroderma result in changes to the skin and the blood vessel, muscle, and internal organ, manifested mainly with thickening of skin and fingers, of the skin of the fingers and toes, and the area of small dilated blood vessels known as telangiectasium. Systemic lupus has wide range of manifestation: pulmonary manifestation, gastrointestinal manifestation, and cardiac manifestation. The most frequent cardiac manifestation: pericarditis, myocarditis, endocarditis, and non-infective endocarditis. Rheumatoid arthritis, cardiac involvement in the form of pericarditis, endocarditis, conduction defects, coronary vasculitis, granulomatous aortitis, and myocarditis. Scleroderma also may manifest with pulmonary vasculopathy and different forms of cardiac affection, systolic dysfunction, diastolic dysfunction, and conduction defects. Sometimes the patient has undifferentiated connective tissue disorders, in which symptoms and signs and laboratory manifestation of the disease is not typical for a specific disease like scleroderma or systemic lupus or rheumatoid. Sometimes it's called mixed connective tissue disease or undifferentiated connective tissue disorder. Evaluation of patient with connective tissue disease should focus on its clinical manifestation affecting different organs of the body besides its general symptoms in the form of fatigue, low-grade fever, gastrointestinal tract, musculoskeletal system, cardiovascular system, respiratory system, skin, and even CNS in the form of trigeminal neuralgia, psychosis, convulsion, or even peripheral neuropathy. Laboratory workup is important in patients with connective tissue disease. They have different forms of affection of the CBC, anemia, leukopenia, thrombocytopenia, elevated ESR, rheumatoid factor, positive in some cases. We should evaluate other organs as renal function for effect of systemic disease. Imaging of the patient, not just for the joints or for chest, and also manifestation of the heart, either by chest X-ray, echo, or cardiac MRI. To summarize, autoimmune connective tissue disease, it affects about 38% of population worldwide. Connective tissue disease are group of disease where the body begin to be attacked its own connective tissue, including internal organs. It can affect heart, lung, brain, and even can affect joints, skin, and even glands. There are more than 200 diseases of autoimmune connective tissue disease. Treatment of such disease mainly using steroid, antimalarial drugs, and chemotherapy. Thank you.